This is the outline of my presentation. So today I'm going to talk about the basic information, the demographic change, aging issues of China, and also how China responds to the aging issues. At last of my presentation, I will also share some of my experience while I'm involved in aging programs in the rural community in China. So here's where China is. As you already know, China has the largest population in the world. By 2013, the population size is 1.3 billion. It's going to hit 1.4 billion, possibly by the end of this year, and which accounts for like 20% of the total population of the world. The current per capita income is 11,850. So which makes China a middle-level income developing country. The GDP growth rate is 7.7% right now, but I don't know what it's gonna be in the future. The national poverty line is 2,300 RMB, which is about $1 per day. So currently, it's 99 million Chinese people who are living under the national poverty line. There are 55 ethnic minorities plus the Han people, and there's 34 provinces in China. In terms of the social work development and social work licensure, actually back in 1922, I believe, there's the first social work and sociology department built in China. However, it was interrupted and stopped during the war. So in the late 1980s, the China started to rebuild the social work education, and several universities start to have the social work department. So by 2007, 211 universities have the BSW program, and 58 universities has the MSW, and 10 universities has a doctor program for the social work. And start from 2008, the Chinese government launched the examination for the social work licensure. So each year, I think it's each June, people can start to take the exam and get the social work licensure. That's a development for social work in China. So before we talk about the demographic trend, one thing we cannot avoid is the controversy one-child policy. So as you may know, under this policy, which is launched in late 1970s, each family is only allowed to have one child, with a few exceptions. For example, if the first child is disabled, or if for the rural families the first child is a girl, they can have the second. And also, the Chinese government delayed the legal marriage age by they postponed it by 2 years. So now the legal marriage age for men is 22, and for women is 20. So because of this demographic policy, it sharply declined the fertility rate in China. So you can see the sharp decline is happened in the late 1970s. So it kind of declined from about 5.8 to currently 1.66. So you can see this is a very sharp decline. And at the same time, with the economic growth and the improvement of healthcare conditions and the improvement of medicine, the life expectancy increased steadily. So in 1960s, just a little bit above 40, but now it's 75 years old. So as a result of the trend of the fertility and the longevity, we can see the share of the older people in the total population in China is changed, is increased. So you can see this is the population pyramid. So you can see the percentage of each age group. This is the left on, man is on the left because the woman is always right. I like that one. On the right, you can see the percentage of the aging population. So by the 2050, more than 30% of the Chinese population will be older adult. The total amount is around 440 million. And for the people who ages 80, they will be kind of like 80%, and the total amount is about 100 million. So we will have the largest aging population in China. Oops. So because of this aging trend, there is a lot of issues such as the financial security for the older people, their care, the health, and also I want to mention more about the biggest disparity in China, which is the rural-urban disparity. And also compared with men, women are more vulnerable. So first, financial security. So in 2010, the ratio of working people and the retired people is 6 versus 1. It's not too bad, right? It's good. But by the end of 2050, the ratio will drop down to 2 versus 1, which means 2 working people will have to support 1 retired older, which also threatens the sustainability of the pension system. So government is also worried about how to pay all these pensions to the future olders. And also, the pension system kind of developed imbalanced between rural and urban areas. In rural areas, only 4% of the olders access to the pension versus 68% in the urban areas. So, which means the older adults in the rural areas, they really have to work to earn their living. So that's also consistent with the findings of other research. Larger percent of the rural olders are still economically active. Another big issue is the care. So as I mentioned, because each family, they are only allowed to have 1 child. So when the child grown up and get married, now that's the shape of the typical Chinese family. We call it 4-2-1, which means 1 young couple, they have to support 4 older adults, their parents, and also 1 dependent children. So yeah, they cannot have like much of financial pressure and the caregiving burden. And another thing happened in China is the massive rural-urban migration. Currently, it's about 166 million people. 6 million rural-urban migrants. So mostly they are the young rural adults. So when they move out, they are not living together with their parents. They cannot really give the timely support. And even for the young adults who are still living in the same community with their parents, they are not really willing to live in the same house. They prefer to live separately. So traditionally, China influenced by the Confucius culture. We really value the filial piety. So the adult child taking the major responsibility to taking care of their parents. But with this, their capacity and willingness to provide care for their older parents are rapidly eroding. Another issue is health. So compared with other age groups, older adults have a high morbidity of chronic disease and disability rate. The statistics shows that the morbidity rate of the chronic disease for older people 60 and above 2 times higher than the average than the other age group. And another thing is the mental health issue. Because most of the children are now living with their parents or living in distance from their parents. So the older adults are also faced with some mental health issues such as depression and loneliness, especially for those we call it empty nest olders. And also currently the healthcare spending on older adults are higher than the average. Another thing is the health insurance. Now both the rural and urban areas has the healthcare insurance. However, the coverage is still not very high, and people still need to pay for out of their pocket, pay a lot out of their own pocket. And the distribution of the medical resources is imbalanced between rural and urban. So sometimes even one serious disease of one family member in the rural areas can cause the poverty of the whole family. Yeah, as I mentioned a lot, because of this rural-urban disparity, so there's a big difference or gap in terms of income, public service, infrastructure, and also social pension and health insurance. So compared with the urban elders, the rural elders will have more difficulties. And another issue is compared with the men, older women will have more difficulties because they are more likely to be widowed, and they are less educated, and they are less financially independent. So to address all these aging issues, the Chinese government tried to make some efforts. So in 1996, they issued the Elderly Rights and Protection Law, and also they have the special assistance, the well-being on the 3-No group, which is the older adults who have no family, no source of income, and no working ability, which includes the mentally and physically disabled people, and also a group of the childless older adults. And for the oldest old who are aged 80 and above, the government gives special stipends to them. And at the same time, the government tried to build more institutions, especially the residential homes for the elders. And now the Chinese society kind of started talking about the issues of aging, and more cooperative investment start to get in the market. They want to provide more services, insurance, like the institutions. They want to just get first into the market. So there are more resources into the elderly care. And also there are some more community-based services by the social organizations, and the government also try to encourage the community-based service by providing more help and policy guidance. However, the situation is not like very positive so far. So far, the residential homes, numbers of residential homes is still very limited, and even for the place where they have the residential homes, their children are reluctantly to put their parents into the residential home. And for some very good quality facilities, it's largely unaffordable for the people. And for the other forms of the formal services, such as the assisted living, daycare center, nutrition, and shopping, transportation, those things still largely non-exist in China. And and also compared with the investment on other areas, the investment and fundings on aging services is still quite limited. And because the social work licensure and exam just started, so we're still lacking of the qualified professionals and active social organizations. So this is about the situation in China. So last, I would like to talk a little bit about the program I have been involved. Before I came here, I used to work for the Help Age International. So we conducted a 3-year program focused on the welfare of the rural older adults, which is the most vulnerable group. So for this group, for this program, we are aiming to reduce the poverty and improve the health care in 60 villages and strengthen the Older People's Association, which is a local association in the village, and also enhance the partners' capacity to replicate approach. So for this program, we have 3 major activities. First one is we want to strengthen the Older People's Association's leadership and capacity. Second, we want to increase their income by providing livelihood access and trainings and information about government service. And last piece is we want to promote the health of the elders by provide free checkups, training workshops on the chronic disease self-management, and also we want to give them more information about what services available in government. Because the situation is most time there are some services available, but the rural adults, the rural elders, they never know it. I mean, where it is, whether it really their service, whether they are eligible. So we hope them to can improve their access to the public service. This is just some example of the activities we do. So for one thing, we organize some participatory trainings. We help the local government partners and the OPA leaders to understand how the aging process is. So that's why you can see some weird glasses and the gloves and some pictures like where there will be a problem, lots of problem picture, and how the older people looks in their own mind. So they will draw a picture like what the older people will be. Mostly people will talk about some negative things like the physical decline and problems. But we'll try to direct people to look at more positive side of the aging process and have more positive ideology about older. Like we want them to see older people as an important resource of the community instead of merely a burden. And also we use a wealth ranking to identify the poorest poor group in the village. And so you can see this is old man is from the Older People's Association. So they try to lead people to discuss different areas of their life and to figure out who are the people who need more help. Then we give some livelihood assets. You can see just some simple things like a machine to making noodles, some cows and goats. So they will kind of can improve their income a bit. This is the other activities, such as we kind of help the community to mapping out all the vulnerable elders, like the disabled, the straight-nosed, so they can better to provide help. And also we ask them to vote for the activities and equipment needed most. So the program can provide those things. We also kind of conduct some cultural and social activities. Before I left, the program haven't really finished. So, but from what I think, I can see some idea changes and the life improvement of the older people and also, the local governments. This is, the program. Okay, thank you. Any questions? This is the younger version of me.